Ladies and gentlemen, welcome to Stuck in the Middle podcast. This is a collab with iHeart Health Expo. Thank you. Shout out to iHeart Expo for putting this together. This is a panel on HIV AIDS, and I'm here with Anya Tabong, my left, and Akokeng Ba on my right. They're both registered nurse practitioners, and also they both possess a Master of Science in Nursing. Welcome, ladies.
Thank you. Pleasure to be here.
Thank you. It's my pleasure and my dream to be sitting here today. So.
Oh man, you had that dream of always,
I
wanting
know.
to be.
I wanted to be a journalist,
Yeah.
and then hey.
We've been teasing you all week. Well, today is that day. Well, thank you guys for joining us. iHeart Health. In this great discussion. This is a topic that society hasn't been talking much about lately. They talk about cancer, mental health, and HIV just went on the rug.
Yep.
You know what I mean? And we've seen stats, and it's crazy.
Ridiculous.
Yeah, so we're here to talk about that today. So, with no further ado, I'm going to let you introduce yourself again. Talk a little bit about you and Akonkeng as well.
All right, everyone. I've been here before with Stuck in the Middle talking about travel. Now I'm talking about real issues. So my name is Anya Tabong again, and I am a nurse practitioner specializing in family practice. Psychiatric medicine as well, and substance abuse. I did work for an HIV clinic, so I've gotten my hands wet with that. And again, I'm very passionate about getting this kind of information back to the community. I think it's very important for all of us to know what it is and what you need to know to protect yourselves from it, and also the mental health aspect that's also connected to this. So I'm here giving out the word with AK.
All right. My name is Akokeng Ba, also known as AK. Hey, AK. So I'm a family nurse practitioner, and I specialize in internal medicine. I did part of my rotations at the Montgomery Health Department working with HIV individuals, so I'm familiar with the statistics and the stigma associated with it. And it's just always been my passion and dream to make society aware of HIV, and the fact that you have HIV, it doesn't mean it's a death sentence. People will have to be aware that HIV is just like any other disease as long as you take care of it with the right treatment.
That's right.
So
Let's get into it.
Show.
Yeah. I'm AK, by the way.
AK1 and AK2.
Yeah, host of Stuck in the Middle podcast. Special shout out to Ali Mufa for putting this together, by
As
the way.
always.
Yeah, let's not forget about her.
Can't forget her.
Yeah, so what is HIV? And
What is HIV?
what is HIV?
What is it? HIV and AIDS. So HIV is the acronym for human immunodeficiency virus. So human being that it attacks humans, immunodeficiency meaning the immune system is no longer functioning, it is weakened, it is deficient, and a virus being an infectious organism. And the thing with viruses is it's an infectious organism that tends to only replicate itself within the host. So the host being the human, and so that's why HIV only affects human beings. So
Yeah.
that's HIV.
AIDS.
So basically, the way in a layman's term, the way you can look at it is that HIV is the virus. AIDS is the diagnosis you get after being attacked by the virus. So you might be living with HIV for a very, very long time, and if you don't take the right medications and your CD4 counts drop, which we're going to talk later on about what CD4 count is, you can get AIDS, and that's when it becomes dangerous.
Right, because HIV and AIDS tends to be used interchangeably, but they're actually two different things.
Right.
HIV is the beginning, AIDS is the last stage of HIV.
And everywhere you see it, you always see HIV/AIDS.
Right.
So that's why people always think it's
The same thing,
but
it's
it's
not.
Yeah.
Oh, okay.
Yeah.
So you have to have one to get the other, if I'm not mistaken.
Right.
Yes.
Right.
So
Yep.
you get HIV first.
Yeah.
And if you don't take care of that,
That's
then
right.
you
It progresses to
eventually-
AIDS.
So
Exactly.
what are some risk factors to HIV? How can you get HIV?
Well, first off, anyone can contract HIV.
Yep.
So you are not exempt from getting HIV. As we said, anyone can get it. Therefore, people at risk are people who have sex. If you are sexually active, you can contract it. There are certain populations that are more at risk. So African Americans tend to be more at risk. Gays, either lesbians or gays. Transgenders are also at risk. People who do drugs and share needles are also at risk for contracting.
And you don't necessarily have to have sex to get HIV.
True.
An innocent baby can also get HIV.
Right.
So, just to put that in.
That's why we said everybody.
Is this a universal thing? I said, like, are there places in this world where you think, there's a low, rate of HIV, contrary to some other place in the world where it's really high? I'm not sure if you guys have looked at the statistics and all whatnot.
Statistic wise, it's more predominant in Africa. Unfortunately, because HIV, there are actually two kinds of HIV viruses. There's HIV-1 and there's HIV-2. HIV-1 is what 90% of the world's population has. HIV-2 is what's common in Western Africa, and 60% of females in Africa actually have the virus. And that's mainly due to socioeconomic status. So you're dealing with women who are dealing with a lot of poverty, so they end up doing, having to engage in sexual activity for funds, to take care of themselves, right, and all whatnot. So.
Yeah. I mean, what do you think, AK?
So like Annie rightly said, there's HIV-1 and there's HIV-2. HIV-2, the good thing about it, in a way, is that it has a slow progression. So you can have HIV-2, but it takes a longer time to progress to HIV to AIDS. HIV-1, however, takes a shorter time to progress to AIDS. And the reason why it's more common in Africa is because of the socioeconomic status, like she said, and a lot of women get raped. And then there's a lot of, men getting married to multiple wives.
That's what I was going to say, polygamous homes.
Polygamous homes. Yeah. So they sleep with their wives, multiple wives, and they have girlfriends outside of the marriage. So that alone, spreads the HIV virus.
I mean, like, this is something, it's not like a cold where, if you stand outside for so long, you immediately, become, catch cold and stuff like that. So how quick can somebody know the HIV infected?
So this is why, as primary care providers, we always tell patients, get your annual physical. You think when we tell you go see your doctor every year, you're like, yeah, I've been busy, I'm gonna do it, But these are routine tests that are done every year with your primary care provider, and you can also go. There are so many clinics as well that do free HIV testing. There are a gazillion health fairs. Like there's iHeart Health in February, that you can get all these free, free testing done. You do get free testing through oral swabs and finger pricks. And once that's done, it normally takes 2 to 4 weeks to find out if you are infected with the virus. However, if you engaged in sexual activity today, and you get a test done tomorrow, it's not going to pick up. It needs at least 2 to 4 weeks to find out. So that's why we tell you to get frequent testing, because even in 2 to 4 weeks, sometimes it might not show up. You have to go back in 3 months and then go back in 6 months.
Right. So for people who don't go for regular checkups, and let's just say, for example, they're infected with HIV, what are the symptoms? How can they know, oh, something is wrong, I need to go check this? And
so that's the thing with HIV, because HIV, the only symptoms that tend to appear are flu-like symptoms. So you feel like you have a cold. You might have some chills, fever, body aches, but that's someone can take as just getting the regular flu and not even HIV. So unfortunately, you're not going to get clear-cut symptoms that are going to be like, oh my God, my right finger is numb, that means it's HIV. No, it is not going to work like that.
Right.
So yes, you will appear with flu-like symptoms, and that's the reason why we tell you to get frequent testing, or if you can, go to your health department and see if you can get a free HIV test. But most common symptoms are flu-like symptoms for HIV.
Right. As nurse practitioners, right, you guys encounter a lot of sick people, a lot of people in need of help. One thing, when I get sick, I hate taking medications, for
Right.
example. You know what I mean? Some people hate going to the hospitals.
Oh, who are you telling?
Yeah, you know, so
Gotta
when you
fight
say,
patience.
so when you
look.
say go do medical checkups, they're like, nah, I'm good.
Right,
I'm
exactly.
good,
You
you
get it
know?
all the time. It's been 3 years, sir. Where you been? Nah, man, I don't be coming to y'all. I don't be coming to y'all.
I just stumbled upon this information, 2 days ago, which is really shocking.
Okay.
I did not know HIV can live outside of the body.
Yeah.
42 days.
Yep.
Up to 42 days.
That's
out of the
crazy.
body.
Insane.
Yeah. Yep.
Talk a little bit about that.
I mean, it is what it is. There's nothing else you can say to that.
Let's say, you get a needle stick. Let's say a person is diabetic, for example, and you use the cotton swab to wipe off the blood, and then you just leave it there sitting out. It's dry blood. But the fact that it's dry blood doesn't mean the virus is dead. So if someone comes and doesn't know there's blood on it and maybe wants to wipe something off from their face and there's a cut there,
Yeah,
that's how you get infected with the virus.
So pretty much you're saying that under the right temperature, HIV could live in dry blood under the right temperature.
Pretty much.
Yep.
Yep.
That's scary because also I heard this story where this dude found out he was infected with HIV and
Went to the movie theater.
he went to movies. You heard that too? Yeah, that's crazy. You know, what I mean, that kind of scared me. You know, like I don't want to go to the movie no more.
Even at the gas station too. Like they put like a prick under the nozzle when you pick it up to pump gas. It pricks your finger, just because of out of hatred, so other people can get infected too.
That is crazy.
Vicious.
Yeah.
That is crazy.
Vicious.
Well, this whole thing came about with the recent statistics. That's been
Got that like 8
going
times
on.
WhatsApp.
Yeah, man, if you got WhatsApp, and let's just say you're African descent, you've seen one of these statistics, going around in group chats and all whatnot. Let me just read a quick, survey that we found online. 30,430 adolescents living with HIV at the end of 2016, and we in 2017 going to 2018, and these are just people who actually went in for regular checkups, excluding those who did not even go in, those who are in denial of going for regular checkups and all whatnot. 1,116 adults reported with HIV diagnosed in just the DMV area in 2016. 485 HIV death reported during the year of 2016. Maryland itself had the 5th highest HIV diagnosis report in 2016. Maryland also has the 2nd highest lifetime HIV risk at all times in the United States.
Wow.
Like, I mean, guys, I'm listening to this and it's mind baffling.
I mean, listening to those statistics, it doesn't mean that Maryland is the most infected. It just means that, the way I look at it, it just means that the Marylanders are more proactive in getting tested and knowing their status. How about other states that don't get tested?
Right.
It doesn't mean that we don't know their statistics. There are a lot of people out there who don't even know they have HIV. So if every single person was supposed to get tested, I bet you Maryland would fall on the lower risk. So I look at it as a proactive way and as a way to say that we're doing the right thing by going out there and getting tested.
That's right, AK.
Is there prevention for this? Is there a cure for this? Is there a vaccine you could take to prevent this? Or if you have it, is there a vaccine you could take to slow it down? Like,
Unfortunately, there is no vaccine.
okay.
Yet.
Yeah.
Yes.
But eventually, they're
Hopefully.
working on some research.
Soon.
Yeah.
That'll come up. So and there is no cure for HIV yet. As AK
But
said.
there is a prophylaxis that you can take to prevent HIV.
Is that like a drug?
Yes. It's medication. It's called the PrEP, which is also known as a pre-exposure prophylaxis. So if you're someone who likes engaging in sexual activities, you don't like protecting yourself, or you're just at risk of having it, you can go to your doctor, talk to your healthcare professional, and they're going to put you on medication. It's actually a combination 2-in-1 medication, also known as Truvada, and you're going to start taking it, and it'll reduce your chances of having HIV. It doesn't mean you're not going to get HIV, but it'll reduce your chances significantly. And the more consistent you take it, the lesser your chances are of having HIV. So you have to take it at the same time every day.
Exactly. Yeah. So you can't take it for 1 week and then miss 3 days and be like, I'm gonna take it. You have to be consistent, or else it's not gonna be effective.
So it's like birth control.
It's like birth control. There you go.
You just have to carry it everywhere you go. Just pop the pill.
I'm trying to imagine a world where I'm so scared of HIV that I have to be popping pills every single day instead of just practicing abstinence, or
this is true.
Just being faithful to one woman. You know what I mean? Like, do you guys see this often? Because I'm just wondering, like, are there people who say, "Oh, I just want, I'm coming in to get the pills, and I'm just gonna be popping this because I'm trying to stay away from HIV, AIDS." Do you guys see this often?
I don't. In family practices, I want to say you don't see that. Well, I can speak for myself. In a family practice clinic, you don't get that. So a lot of patients actually feel uncomfortable talking about their sexual practices. So as a provider, it's very important that we actually encourage and engage and get that information from our patients, because they're not going to talk about it. When I was working at an HIV clinic, however, because we're an HIV clinic, we did get PrEP. There are people that actually Google and that particular clinic that I worked at would come up, and then they would come in and consult, because a lot of patients have a hard time discussing PrEP with their providers, because there are actually some providers that they're not even interested in doing PrEP. For me, it's just like, why? But yeah, so you do. It's like once in a while you'll
most
get
of the people who actually do it are the gay, because they engage in a lot of risky sexual behaviors. And anal sex is the most as far as transmission.
Exactly.
Anal sex tops the list.
Yes.
Because of the skin barrier of your anus, and the
Lot
fact
thinner.
that the receptive cells for the HIV is right there waiting for the virus. So as soon as it comes, it grabs it because of the barrier. But the vagina is not as thin as the anal.
Exactly.
Since we're on the topic of how you contract HIV/AIDS, saliva. Can you contract AIDS through mouth to mouth?
Yes, if you have a cut, if you have an open sore in the mouth, and let's say you're kissing the person and the person also has a sore and there's some blood, that's how you can get it. But
saliva,
research is always also being done that saliva can act as a barrier to prevent HIV. So if you don't have any cut, then you can't get HIV from saliva.
Right. So it has to be an open wound present.
Yeah.
Yeah.
I'm about to get a little explicit on here. Since we're talking about health,
Right.
let's not hold any cards back.
So what you about to ask now?
In terms of oral,
It's PG-13.
I hope so.
PG-13.
PG-13.
We can't do rated R now. We got the children's listening.
Oh, man. I'll try to keep it simple. Oral sex. You have all the, like semen and vaginal juices and all whatnot. If somebody has HIV, and let's just say somebody, a man or a woman was performing such an act.
It's the same concept as the saliva. You can definitely get HIV through pre-cum and cum, and through vaginal fluids as well, if the person is infected with HIV.
How? I mean, we normally say blood. It lives in blood. So how can it live in?
It does. It lives in. It's part of the DNA. It's in semen. It's in pre-cum. It's in vaginal fluids, because the HIV is actually in DNA, which is also present in those same fluids.
So you're saying that, like the lesbians, women who have sex with other women, they too can actually contract HIV.
Absolutely, because they tend to use, some of them use sex toys, and then they penetrate anally, which can also easily break the skin. And so if they're HIV infected and they're mixing it with toys, not washing toys, and then it gets messy. And then if they have other parties involved, it gets transmissible that way too.
Let me try and dig up a little bit of my biology, right? So we could try to make sense of what really happens when you get infected by HIV. So I know the white blood cells is the thing that fights infections, right? When HIV actually, when you contract HIV, what happens?
So the thing with HIV is It's a virus that attacks your immune system. Now, your immune system is made up of T cells and B cells, which are known as lymphocytes, right?
Okay.
And so your T cells are composed of CD4 and CD8 cells, and then you have your B cells. So the thing with the CD4 cells, those are the cells that actually lead to fight infection. Those are the cells that actually lead to fight infection. So if those are being destroyed, then your B cells, which also help fight infection, and your CD8 cells, which are the killer cells of infections, are also being destroyed. So that's the thing so that's where we tend to look for CD4 counts when you go to your doctor, and those who are HIV infected, you'll hear that number CD4, because that's actually a white blood cell that's being destroyed by the virus, and that's the same cell that fights infections when you are being invaded, when their pathogens are invading your body.
And the normal CD4 count should be between 500 to 1500. So once the HIV virus attacks the CD4 count, those numbers start dropping. And like Annie had earlier mentioned, there's 3 phases of HIV. There's the seroconversion phase. That's when you initially get attacked by the virus, and that's when you start getting the flu-like symptoms, and your lymph node starts getting swollen. And for women, one of the earliest signs of HIV is yeast infections. If you have 4 or more yeast infections in a year, definitely get checked out.
Yep.
If you have oral thrush, which is like whitish patches on your tongue, definitely get checked out. Those are the things we look for when someone comes into the office and they have all these complaints. One of the tests we do is the HIV testing. So after that phase, they go into the latent phase, which is when the virus is still in you, but it progresses at a slower rate. So during that phase, you can still transmit it to another person, and it can take up to 10 years for you to be in the latent phase without any medications. So when the CD4 count drops below a certain level, in some countries, especially like in the African countries, some providers don't give antiretroviral treatments until the CD4 count drops below 350 because of the resources available, to give medications. But most of the time here, once you get the diagnosis of HIV, you automatically go on medication.
Quick.
Yep. And once your CD4 count drops below 200, it's an AIDS diagnosis. And that's without medication. But if you compliant with taking your medicines every day, your CD4 count is going to stay up. And they also measure the viral load, which is the amount of HIV you have in the blood. So as long as you take your antiretrovirals, your viral load stays low, but it doesn't mean you cannot transmit the virus to someone else, because you still transmit it in semen, you still transmit it in pre-cum, you still transmit it in vaginal fluid, and you still transmit it in rectal fluid. So those are all the factors that healthcare providers look at.
Right.
Yeah.
We were having a discussion before, this panel, and we, came up to the finding that there are some people who are actually immune to HIV.
Yeah.
How
Those
is that
people
possible?
are the people with the Delta 32 gene, and it actually fights off the CD4, HIV virus when it comes in contact with the HIV virus. It's attached to the CD4 count. So it's just a rare amount of people who have that gene. But yeah, they can't get the HIV virus.
What are the different ways people would get tested for HIV? I mean, are there places where, HIV testing is free, or do you always have to pay for it?
No, there's a lot of free HIV testing that's being done. We had Chase Brexton in Baltimore. I believe there's one in Howard County as well. They do free testing. Andromeda Transcultural Health in DC, they also do free testing. I want to say
In the Maryland, different health departments.
Definitely
like
call your
Montgomery
local health
County,
department, Montgomery County,
Howard
PG County.
As long as you have your ID.
Because if
proof
they
that-
don't,
yeah.
if they don't actually, they'll tell you where you can go to get it done for free. Yeah.
Well, by the way, if you're just joining in right now, this is a discussion panel on HIV/AIDS. To my left is Anya Tabong, and to my right is Kunkeng Bak. Let's get back to the HIV topic. In comparison, I want to compare HIV and cancer for a bit, right? And some people say the mortality rate with HIV is a lot less than cancer. Do you think that's true, in your opinion?
I mean, for me, I could never say or even tell a patient one is better than the other. Um, Again, I'm going to preach primary prevention. If cancer is caught early, your prognosis is definitely going to be a lot better. If HIV is caught early, because these are things that they're not fatal. They're not always fatal. HIV is not always fatal. If it's caught in time to where it hasn't progressed to AIDS, you can get on medication therapy and be monitored. It's the same thing with cancer. If you do regular checkups, you do your mammograms, you do your colonoscopies like they tell you, you see something funny, you go to the doctor and get it checked out. Once that you're stage 1, stage 2, you can go ahead and start chemo. If they have to go ahead and do what kind of a surgery to take out whatever organ that needs to be taken out, then fine. But when you don't get checked up, these things went out. They're going on. You don't know that you don't know that your HIV has progressed to AIDS. You don't know that your cervical cancer or your colon cancer has now progressed to stage 4 when you were never going to the doctor to get these things looked at. And then that's when they become fatal, because now you're at a stage 4. When 5 years ago, if you were going to your doctor's office, or 8 years ago, if you were going regularly to get these things routinely checked, then, so I for me personally, I can't say one is better than the other.
In my opinion, if you look at it closely, HIV to an extent is better than cancer, because with HIV, as long as you go to get an HIV test and they tell you you're positive. With cancer, yes, there's breast cancer, there's prostate cancer, there's colon cancer, and all these different kinds of cancers, you don't start getting tested for them until you get to a particular age. Like for breast cancer, they said you don't get mammograms until you're the age of 40. For colon cancer, you don't get a colonoscopy until the age of 50. For prostate cancer, they don't start doing blood work to screen for your PSA levels until you're 40 or 45, based on your risk factor. Let's say I had a case the other day, 25-year-old. She didn't have any symptoms, just abdominal pain. We did further testing. We didn't find anything in the blood work. Maybe her red blood cell count was a little low. We sent her to the hematologist. They decided to do a colonoscopy. Lo and behold, it was colon cancer. So if she, on the other hand, went for an HIV test, they would tell her immediately that, hey, you have HIV. And then she will start taking her antiretrovirals and she'll be fine. But now that she has colon cancer, it's stage 4. What's the prognosis? So in my opinion, as long as you stay on your medications, as long as you're compliant with taking your medications with HIV, it's better than cancer, because cancer, it's iffy. Sometimes just the chemotherapy medications kills you from, what you take for cancer. So having a diagnosis of HIV is in a way better than cancer. So it can be looked at in 2 different aspects.
Right. Let's focus a little bit on mothers, because, mothers, they bear kids. Mm-hmm. So if a mom is infected with HIV AIDS, is this child also prone to have HIV AIDS?
Yeah, so that's always a very hard discussion, because I've actually had a patient like that who was, she had 8 kids. 8, and she had HIV. And she was lucky enough, none of these children had HIV. Now she's coming in for her 9th child, but she had stopped taking her HIV medication for quite some time. So she was debating, I haven't been taking my HIV medicines. I'm pregnant again. I don't want to bring a child into the world with HIV and yada, yada, yada. But you definitely are able to not pass on HIV if you are on antiretroviral drugs, which is actually amazing. Yeah, so, for someone that does have HIV and is not on any therapy, you are definitely going to more than likely pass on HIV to...
Let's focus a little bit on that, right? So, was the husband HIV infected as well? Oh, she wasn't married?
She wasn't married, but it was her boyfriend, and her boyfriend did give her HIV.
Wow. Yeah. So, two HIV patients, per se, having sex, and, to conceive a child... If both of them are not on their medications, what could happen to them?
You mean the baby or the individuals themselves? Individuals themselves. Well, this is what happens. Your CD4 count lessens, your viral load increases, and this puts you at risk for all kinds of infections. So your immune system is weak. And so you can get sick and just die. So that's why we preach antiretroviral therapy, because we want you to have enough white blood cells to fight infections. You know, we want the amount of HIV in the blood to lessen. See, and this is the thing, you know, I get patients that get so confused. They're like, oh my God, when they see their HIV, because they'll see their viral loads, and the minimal, how it's read is, it's normally read as undetectable. So when they're seeing undetectable on the lab test, it's like, oh my God, it's gone. Actually, no, it's not gone. It's there. It's just so minimal that we can barely see as much versus having a count of 200,000 HIV cells. So that's definitely why we want you to get on medication. And honestly, to also say, I've had patients who get monitored regularly and have not been on HIV medicine for 20 years. They came in, found out that they got tested like in 1992 and did not take a drug. So we call those treatment naive patients. So those are patients that technically their immune system is pretty tough. Their viral loads are high, their CD4 counts, their viral loads are somewhat suppressed, but their CD4 counts are maintaining, which is the white blood cells that we're talking about that the virus infects, and they're not on medication. And so we tend to monitor them. So if anything kind of goes crazy, we have to kind of encourage them to get on medicine.
And it could also be due to the fact that they might have HIV-1 or HIV-2, which with HIV-2 there's a slower prognosis or slower progression. And a lot of HIV patients fail to understand that, like a couple, the wife might be HIV positive, the husband is HIV positive, and they're like, hey, we're both HIV, so let's just go ahead and we don't need protection. They fail to understand that you can get a super infection. So the wife might have HIV-1, the husband might have HIV-2, and they infect themselves, and then they become resistant to medications. So even though you're sleeping with someone who is HIV, both of you have HIV, you still have to be on the antiretroviral medications and take precautions.
Yeah. They're the practitioners. They know this better.
And to add in, I know I'm kind of going off topic here, but definitely HIV can also be transmitted through breast milk. Yeah.
Touch a little bit on that.
So definitely, like we were talking about fluids, bodily, vaginal, pre-cum, cum, and all of it. It's also a bodily fluid that can be transmissible. So if mom is not on heart therapy, you definitely need to get.
So is it still the skin or is it the milk?
The milk.
How?
It's part of a bodily fluid. The only bodily fluid that is exempt from the HIV virus is saliva. All other bodily fluids are, you can get HIV transmission.
So the notion that HIV lives through the bloodstream, that's false?
No, it's not false.
I mean, it does live there, but it also lives in other places.
DNA.
Interesting. Well, okay. Now that we've tackled HIV/AIDS, what it is, how it's transmitted, and some stats about it.
Yeah.
Let's focus on preventions. And
prevention.
Yeah, prevention. So
don't have sex.
Stay away.
For those who don't want to stay away, for those who don't want to stay away,
for those who don't,
for those who don't believe in abstinence,
for those who want to engage,
yeah, y'all mentioned a little bit about earlier y'all mentioned PrEP,
right?
And there's also PEP,
yeah.
So could you guys distinguish, like, what is it first?
Right.
Off,
so PEP is post-exposure. So let's say you had a needle prick, or I've actually had a patient who he was a gay African American male, had sex on a Friday night, comes to the clinic, actually called our hotline, but it was the weekend. So comes in first thing Monday morning, is like, I just had sex with a partner and he just told me that he was HIV positive. I was like, so why he ain't tell you this before though? But anyway, he told you after the fact. So what do we do? So we immediately went ahead and did some blood work, and we actually started him on antiretroviral therapy. So technically 72 hours after exposure, you can actually start HIV medication.
Up to 72 hours.
Yeah. Up to 72 hours, exactly, yes.
Just like the day after pill for women.
Yeah,
I'm sure
exactly.
some women know, if you...
Like the Plan B.
Plan B,
Mm-hmm.
right.
So what
works
about
like that.
HIV, in contrast to STIs and, gonorrhea, chlamydia, and all whatnot? Like, if you have HIV, like how slim is your chances of actually getting all this other STIs, this other little diseases that...
You're actually more at risk. because if you are engaging in, in sexual activity unprotected, then you are also more likely to contract gonorrhea, contract chlamydia, herpes, syphilis. And then if you're HIV positive on top of that with a weak immune system, your immune system is not even strong enough to even fight off these infections. So you're more likely to also get these STDs as well. So that's why we always, and even with most HIV patients, we also check routinely for STDs as well.
Right.
Yeah.
Let's, take a little break real quick, answer some of the, questions that are coming from online. And this comes from L's. Is it L? L Thrive? My bad if I butchered the name. But he asked, are people still able to get AIDS in 2017? I think that's a pretty naive question.
100%.
Yes.
Facts. Facts.
And what is HIV-2?
So like we were explaining that the virus, HIV is a virus, but it comes in two types. It comes in HIV-1 and it comes in HIV-2.
So HIV-2 is the one that has a slower progression, and it's common in West Africa.
Exactly.
HIV-1 has a faster progression, and that's like 90%, I think, of the general population.
Of the world, actually.
Yeah.
Okay. Moses asks, is it true that some people have cured from HIV?
Not to my medical knowledge.
Doubt that.
I've read no articles. I've seen no articos, no documentaries, nowhere. I mean, if you know
they might
where
have
it is,
an undetectable
Moses,
viral load, but
if you know where the cure is, Moses, you come on in and share because you about to make millions.
Can you catch HIV through sweets if you have a cut on your body?
As in
candy.
It's a possibility. I would think it's a possibility because if the person has a cut and there's some blood on the candy and you pass it on to the next person and that person sucks on the candy and has a cut, hey, there.
The risk is extremely low,
slim,
but it's possible.
Yeah.
That's about it for the questions online. I believe so. Yep. Keep shooting your questions, guys. We have the practitioners here. Anya Tabong, Akun Kangba. They're going to answer them for you. I don't have all the questions, so I need you guys to ask questions.
And in regards to just a little addition to what Annie was saying earlier on with STIs and HIV, the fact that you have an STI, let's say like herpes, you have open source, that predisposes you to getting infected by the HIV because the source could be anywhere on your body. It could be on your thighs, so just rubbing can make you have the HIV virus. So
wow. Yeah. Don't touch me up, I beg. But where could people find resources, information about HIV, like real statistics about HIV?
CDC. The CDC website unfailingly has, and they constantly update their information with basic HIV facts, where to get tested, and statistics, percentage-wise. And that's definitely and I want to say HIV.gov. There is not an international website, but there is HIV.gov, I want to say, that also has a lot of information about HIV on there as well.
And there's also a website, I think it's called Face of HIV, where people who are actually diagnosed with HIV give their real life testimonies and stories on how they're living with HIV. Yeah.
We also have a full packed house. When we record in the studio, people is welcome to come, sit down as audience and watch as well. And we have a couple people in the audience who have questions. DJ Barack, let's hear your question, man. Well, DJ Barack is kind of shy right now, so we'll just let him have
DJ Barack is like, they answered all the questions.
I think my question is personal.
So we need a consultation after. Yes. All right, we gonna consult after the show, so we don't have his business out there.
Rated R, you said.
Oh man. So let's go through, some factors that, other factors that people are not really aware of, when it comes to HIV and AIDS, right? So you mentioned breast milk. People, you could contract HIV through breast milk, kissing mouth to mouth, open sores, oral sex,
Right.
saliva, which is still crazy to me. Unprotected sex.
Yeah.
Help me out here, guys.
Right.
Is there any other
unprotected
mention?
Um,
Oh, needles.
Needles.
Yeah, through
IV
needles.
needles,
Yeah.
Definitely.
Drug abuse.
Get a lot.
Drug
Because I do
abuse.
substance abuse as well. So I have a good number of patients who have HIV and hepatitis.
And
from
getting
from sharing
tattoos
needles.
for those who get
Yes.
tattoos.
So
Haircuts. There's a slim chance if you're cutting the person's hair and they have a cut.
if they're not clean, if you're not using clean material, so if someone is shaving and has a cut with someone who's infected with HIV, if you're not sterilizing needles and cleaning shaving equipment, like you can definitely contract it.
And blood transfusions. Especially back then in the 80s when the blood wasn't getting tested. A lot of people contracted the HIV virus from blood transfusions. But now there's a lot of precautions.
Lots of precautions. I mean, now when you're going to donate blood, they do HIV testing. So if you're positive, you can't donate. You can't even donate.
Yeah. Gotcha.
Yeah.
So what medications are out there, to help?
Lord.
Prevent,
There's a
HIV
lot.
and AIDS?
There are lots
Gazillions.
of medications. And just like with mental illness and antipsychotics, you have to keep changing the medications until you find the right fit for the person. It's the same thing with the HIV medications, the antiretroviral treatments. You have to keep changing the medications until you stabilize the CD4 count. And some medications are geared towards HIV-1 and other medications are geared towards the HIV-2.
Right.
And some people have to be on multiple medications.
Right. So, because it kind of, and just to jump into what AK is also saying, absolutely. Because it also, when they start you on HIV medications, they look at, your kidney function, look at liver function, because these medications, as all medications do, they have side effects. Right. So, you're going to do basic lab tests. We want to make sure your liver and kidneys can maintain so that you can start this therapy. And then you also have drug resistance, allergies. So these are things that they're also looking at. And then compliance, because that's the big thing. Now that they're like over 30 HIV medicines now versus like the 2 or 3 that they had like 20 years ago or 30 years ago. So we also look at compliance, the size of, because I had one patient who can't swallow pills. Wow. So if I can't swallow pills, what can I crush them? Can I, what can I put them in pudding? What can I do?
And there's some medications you can't crush.
And there's some medications exactly. Yeah. So thank God we have all these options, and so they'll definitely look at what fits you, biologically, chemically, and then what would be comfortable, because we want to make sure that you can take the medication daily. So we try to get something for your fit.
And just like taking antibiotics, if they give you antibiotics for 10 days, you have to make sure you complete the entire course for 10 days. If not, the bacteria is going to get resistance to the antibiotics, and then later on when you really need it, it's not going to work. It's the same thing for HIV antiretroviral medications. You have to be consistent with taking it. If not, your CD4 count is going to replicate, and that might not work for you anymore.
Exactly, and that's where drug resistance comes in. So we always tell patients that you have to be compliant with your medications, because you can end up developing a resistance. So what happens now is the virus mutates. You'll hear about mutation. So the virus now mutates because it's now recognized this medication that you were taking for 6 months, and then now for 3 months you stop taking it. That medication is no longer going to work. We're not going to have to change it to something else.
Right.
Yeah.
Like mental health and other diseases, HIV has a stigma as well.
Big fat one.
Yeah. So how do we mitigate this stigma? Like, how do we get people to start talking about it or continuously talk about it?
Doing what we're doing today, AK.
Elaborate more.
So it's again, stigma is attached to everything, and I always believe that we start with conversation, just like we're doing today. And mental, depression and HIV go together hand in hand because of the stigma, because of the stigma. And so patients who are going through any mental health disorders or illnesses, we try to make sure we can get that stabilized, because if you're feeling down all the time, you're more likely not going to take your medication. You're not going to do what your infectious disease doctors have asked you to do to be compliant. Therefore, your HIV goes out of whack. But as far as stigma is concerned, it's all about don't be judgmental. And that's why HIV is not even being talked about, because we're quick to judge. And then again is education, is being able to talk about it. People talk about sex, you talk about everything else, but why can't we talk about HIV? It's just the people are scared, but now we shouldn't be. Imagine what people were going through in 1988 versus now, where we actually have treatment. I mean, I have patients from the 80s who are looking HIV, it's not running across your forehead. They walking down the street, they look better than me and you.
Yeah. That's what I'm telling y'all, man. We have to come up with that like the police scanner thing to check on speed. We gotta do an HIV one.
They
just
look
point at
great.
somebody, say ding, HIV.
And the main thing associated with stigma is the fact that people are tying it to promiscuity. They're thinking that the fact that you have HIV is because you were promiscuous. That's not true. Innocent wife might be sitting at home, her husband goes out there, cheats on her, and comes home and has sex with her, and she gets the HIV virus, and just because she's busy with the life of raising kids, she doesn't know she's infected. A husband, on the other hand, can also go through the same thing. His wife goes out there, cheats on him, cheats on her, and then brings the HIV virus. So you can't judge anyone because they have the HIV virus.
right.
The fact that they have it, you don't know how they got it. You have to commend them that they went and got tested.
Absolutely.
And they know their status. So, the stigma is really something. Education is the key.
It is the key, because I have patients also that who I used to see for primary care, and they have infectious disease doctors who actually have the virus. They are HIV positive. So yeah, and they share it with their patients, like, look, I'm HIV, and so they're like, oh, OMG, like, you're a doctor, you have HIV, but they're doing what they're supposed to do. That's the thing. HIV doesn't pick and choose. Anybody can get it. Right. So, a doctor being able to explain this to his patients and to be open with, that's a beginning. That's amazing. That's how it should be. And
in some
that's
states,
getting rid of stigma.
There are laws that if the person intentionally gave you HIV, you can take that person to court and that person can be sentenced.
What states is this? I need to move to that state. But I was reading this article today. Okay. And it's so funny that we're having this conversation on the same day this happened. Like, the Trump administration just suddenly fired everybody on HIV and AIDS community. Like, it's
did not know this.
How was it to have just 2 staff? Like, all the members of this, committee, they fired everybody and they just left with 2 staffs.
I'm not.
I don't know if you read this, but it's definitely.
I'm not. This particular administration, I'm really not a fan of them. So I'm going to reserve my comments. I'm going to reserve
live on Facebook.
Yeah. So he does what he wants to do. So personally, but I'm gonna leave it at that.
Man, so how, as a nation, right? How can we come together to, fight HIV and AIDS? I mean, I know you guys mentioned, word of mouth, for example, like people need to start talking about it. But what else can we do?
People need to be more conscious and put in more effort into taking care of themselves. You should want to live long. You should want to be able to, aspire to live long enough to do things in life. So it starts with you. It starts with me. It starts with being proactive about your health. So, even if you're uninsured, like we said, call your health department. Go to Google. People are really, and this is the thing, we have to kind of, I don't know, I wish I had like some magic wand to like put over people, because they're scared. People don't go because they're scared. That's the other thing. Like,
fear of the unknown.
Right, fear of the unknown. Like, I don't want to know if I got the age. I ain't trying to know, because that's going to F me up. I ain't going to be able to function. But it's like, if you know now, it's true, because that's what they tell me. That's what my patients tell me all the time, because it's to a point now where when they come in and I'm doing a routine, because with me it's mandatory. If I'm doing a routine physical on you, I'm telling you I'm doing all these, your kidneys, your livers, I'm doing all of that, right? But guess what I'm also doing? I'm doing STDs. We're going to find out if you got chlamydia, gonorrhea. We're going to find out if you got HIV too. And they're like, wait a minute, HIV? I don't want to know. Yes, you do. You want to know, because guess what? I'm going to run that test. Right. It is part of an annual physical.
The sad thing is that you have to get a consent to get a HIV testing.
So that's what I'm saying. I tell them
refuse and say,
no.
Hey, I
that's
don't
what I'm
want
saying.
it,
I'm telling,
you know.
and that's true.
Yeah.
And that's why I have to tell them you can't do it behind. I'm telling you that I am going to do an HIV test, and like she definitely said, you definitely have to get consent because they can refuse, and I've had that happen. They did refuse, and I have to honor that. But then, as a provider, you educate. This is why I am doing it.
Yeah.
Because of so and so and so and so. And so they're like, all right.
Especially the married one, just like, no, I trust my partner.
Yeah.
I'm good.
I
I'm
get
good.
that too.
Yeah, all the time. But hey, you never know.
How do you play that trust factor though? Like, how do you go about that? Let's just say your partner's like, hey, I trust my partner and stuff like that. I mean, even with trust, like, is trust even enough when you talk of HIV/AIDS? Is trust enough?
Trust is not enough.
It's not.
It's not enough. If you trust your partner, get tested. Go for yearly testing.
That
you
is
can
trust.
your partner, but you can still go for yearly testing.
Right.
Yeah, and exactly.
Yeah,
that's trust.
that is trust.
Yeah.
Trust is, let's go get that HIV test. You
And
negative?
before
All right.
you even get married, it's important and very imperative that both of you need to go for HIV
Absolutely.
testing before you engage in any sexual
Because it's not,
activity.
like we said, you can't contract it only through sex. There could have
Right.
been other ways you could have contracted it. So definitely.
So to all my young people out there, all my singles, please go get tested before you engage in any sexual activity.
Yeah.
There was this case, this guy, he was about to get into a research to find out about the pre-exposure medications. So he did HIV testing, like a month, like 1 month HIV testing after being exposed, and it came back negative, and he got very excited. He was like, oh, I'm HIV negative. 3 months later, he went for the second testing, and he came back positive. And within that 3-month period, he didn't engage in any sexual activity. So the fact that you go for the first time and you're negative, you still have to go the second time and the third time. So you have to continuously, it's advisable to go every 6 months if you're the kind of person that engages in risky behaviors.
Behaviors.
Right.
Absolutely.
You got none to hide, right? So why not go get tested?
That's what I'm trying to say. That's the trust.
Okay. There's a mental health aspect to this. And you're the mental health expert, for people who, let's just say, walk up to the hospital and say, oh man, they're so confident in themselves. Like, yo, I don't have HIV. There's no way I could have HIV. Then all of a sudden come back positive. There's that switch. There's a click right there. I mean, for some people, there's that click like, oh man, how did I get it? They start going down the list, like what girl or what boy might have possibly infected me with this. And they can't really pinpoint that person. So the initial thought is, I might as well pass this on to other people because somebody gave me that. You know what I mean? Like, let's talk a little bit about that mental aspect of it.
It's rather unfortunate, but that has happened where it was years ago. A 21-year-old comes in and she gets tested for HIV. It was because we had free testing, and she got it done and she was positive, and she literally broke down like on her knees and went haywire. So let her have that moment and then get her back up, give her a hug, and tell her, look, this is the situation moving forward. This is how we're going to take care of it. It's a good thing that we do know now. And so you give them their initial resources, and the good and another thing we try to do with patients like that is constant follow-up. You check on these patients constantly, phone calls, emails, if needed, and counseling.
Yeah.
Definitely, because that's number one. Now, with mental health, it gets tricky because you're going to have, sometimes you just can't pinpoint the patients that would do those things, that will go out and because you have them, they intentionally spread. So, I'll do my part and tell them, try to encourage them and motivate them to take care of themselves and, to live with the disease. However, you're going to have some who are just going to, those patients, they're never going to, they don't express that to you. You only hear about things like that after the fact. But it's just your job as a provider to pretty much coach, encourage, and counsel.
And the mental health aspect comes in because of the stigma associated with it. They're like, oh, what are people going to think about me? What are people going to say if they know I'm HIV
Or
positive?
why me? So
am
they
I
get
ever going to
upset.
get married? And then they start looking at it as a death sentence, because of the lack of education or lack of knowledge. So that's why it's important for everyone to know. That's why we're doing this today, so people can know that HIV is not a death sentence.
not.
Yeah, it's just like
Right.
any other disease,
That's
as
right.
long as you take care of it.
Right, and you don't even have to go to infectious disease doctors anymore. They have now classified HIV under a primary care type illness. It's not even something to where you have to go to a primary care provider can manage HIV now, because it's become that simple.
Wow.
Yeah.
And just out of topic a little bit, sadly enough, if a husband comes to me and he's HIV positive, and the next day I see his wife, I can't disclose to the wife that your husband is HIV positive. That's against the law.
Mm-hmm.
So that's something that I think needs to be worked on.
Yeah.
'Cause,
This is
you know,
true.
Yeah.
That is crazy. So it's like
I'm going to
seeing
get in
a
trouble
crime.
if I do that.
It's like seeing a crime that's about to happen,
Or
but
has
you
already
can't-
happened.
but you
Oh
can't
yeah.
stop it.
Yeah.
Oh,
Yeah. This is true.
that's insane. But
Patient confidentiality, can't violate that.
wow.
Even a child, that I've had a situation like that where it was a mother and child that came in, and the child was 18, brought in by the mother, and we couldn't say anything to mother. Mother didn't know. Yeah,
That's crazy.
it's crazy. I know.
I mean, dealing with this health thing, there's so much red flags, you know, that just. Anyways, as we wrap up, well, there's a question. All right, what's the question?
All right, guys. I think there's a question that we need to talk about, and the question is, how do we introduce this into our family homes as far as us Africans are concerned? Because there's something that we do shy away from, the sex part, and as far as HIV is concerned, because it's a stigma in our homes. We're scared to talk about it. We're scared to even reveal to the public that this person in our family has it, and we can use that as a lesson to teach the rest of the village or teach the rest of our family members that, guys, we can try to use protection or try to use different means to go about, birth control pills and stuff like that. How do we bring this up in our family gatherings, in our family homes? Because us Africans, we're scared. Not only that, but we're shy.
Right,
Yeah.
right.
Yeah.
The most
So
important thing is to start educating your kids. Oh,
So the question was, and this is a question from DJ Barack, one of our audience here in the building. How do we introduce HIV and AIDS into our households? Considering the fact that in let's just say African, descent, we're scared, shy, fear of the unknown, per se. How do we introduce this topic into our households?
we have to start educating our kids at a very young age, especially in this society that we live in today. Kids know about sexual activities at the age of 8 or even younger. It's talked about in school. So we have to take it upon ourselves to sit down with our kids, with our cousins, nieces, nephews, tell them about sex, tell them about how to protect yourself if they start having sex. The smart ones are those who bring their kids to the clinic and tell us that they want their kids to be on birth control pills. Those are the smart moms, because they're telling their kids, they're encouraging their kids in a way. They're like, okay, if you have to go out there and have sex, protect yourself. Or they give them condoms, especially the boys. They give their kids condoms. They're like, hey, if you have to do anything, protect yourself. I'm not saying go out and do anything, but if you do have to do anything, protect yourself. So the number one thing is educating our kids at a very young age. And for our family members who might be HIV positive, I would love for it to get to that point where everyone can come out and say, hey, I'm HIV positive. I've been living for 15 years, 20 years. It's not a death sentence. So that's why there's this website called Face of HIV, where a lot of people come out and talk about their HIV status, so that other people too will not shy away from talking about their HIV status, and to educate the population about it.
Right, and with all this technology now, I know some parents have such a hard time being able to, divulge into that conversation. So, with all the technology, you have apps, there are YouTube videos, hey son, hey daughter, or hey cousin or niece, I want you to look at this. You can definitely do that too if you have such a hard time expressing it yourself. You can definitely share. Netflix has so much. There's so many documentaries on Netflix. Like, you can definitely, pass those on as well to family and friends.
Yeah. Well, I've learned one thing today.
What's that, AK?
And that is
Abstinence.
That's one thing I've learned today. I don't know about y'all, but I'm definitely going to try to practice that going into 2018 because this is no joke. Yeah.
Wow.
Oh, we have another question.
Well, actually, if somebody who's infected, he's on his meds, and can he infect his partner, or is he gonna be good like his partner?
So the question is,
That's a good
if
question.
somebody was on their medications, well, they have HIV and they were on the medications, can that person affect their partner?
Magic Johnson.
Yep.
They
Like
sure
we
can.
said, it's not just the blood. HIV is not just present in the blood; it's also present in the semen. So the antiretroviral medications, what it does is that it suppresses your viral load, but it doesn't suppress the load in the semen, in the cum, in the rectal fluid. So you can still get it through all those other resources or through all those other means.
It's just that your risk, you can definitely be infected, but your risk is a lot lower. As far as being transmissible, yes, it's possible, but your risk is a lot lower if you're compliant with medication.
How did Magic make it? Magic is on.
Magic had money.
That long money. They got
Right.
long money. Another question.
I mean, just to kind of add on to it, like, is he actually like cured from it? Like,
You can't be cured from HIV.
okay, so there's a
Yeah.
stigma going on that he's actually like free from the virus.
No, he has it.
You just got disciplining people around.
That's right. He has it. That's the thing with HIV. There is no cure. Once you have it, it's present. It is in the blood. But when you're on medication therapy, what happens is it suppresses it to where you're not as at risk of transmitting. So your risk is just a lot lower versus someone who doesn't take it at all. So I normally draw a picture for my patients when I'm trying to explain viral loads to them because they're like, it's undetectable. That means it's gone. I don't got it no more. No, you have it. It's just that, I'm trying to, it's like a jar of marbles. Let me say, if you have a jar of marbles and the marbles are like the HIV virus, and it's a full jar, that's someone that's not on HIV medication. So you have a full jar of marbles. They're not on HIV. That's how many viruses are in the blood versus a jar that has only 5 marbles in it versus a jar that had 3,000 marbles. And then you have a jar that has just three marbles in it. And that's someone that's actually on HIV medication. So imagine that. So if I'm transmitting, a 3,000 viruses versus 2, so your risk of transmission is a lot lower. Does that make sense? Yeah.
And I actually have a friend back home. He's been HIV positive for about 20 years. He's on his antiretroviral medications, and he's pretty good at pinpointing when you have HIV. He's like, oops, I see those spots. You need to go get tested. And he's not as shy or ashamed of saying he has HIV because he wants everyone to be aware of it.
Mm-hmm.
He got diagnosed at the point where his CD4 count was almost to the AIDS phase. He got very sick. He started having diarrhea. He lost a lot of weight, and he went and got tested, and he had HIV. Then he started on his medications, and it's been 20 years, and he's still living healthy. You can't even tell he has anything. So if everyone could have his personality and just educate people and not be ashamed to tell people that he has HIV, the stigma is going to reduce. I believe that.
Can you guys reinforce the myth that if you HIV positive and you could transmit it through sweat? Because that's what happened with Magic. When he found out, his teammates didn't want to play with him because they thought if he's sweaty, we could contract it.
So the thing is, when Magic contracted it, that was like 1990 when AIDS wasn't, research was still being done. It was still one of those newer diseases that had just come out, and people didn't really know much about it. So the stigma then was insane versus now where we have all this antiretroviral therapy that's been out, and we have a lot more people that have contracted disease, and there's been so much research from now and then. So yes, it is true that HIV cannot be contracted through sweat. No.
Okay. Any more questions, folks?
I got a question. Do you all know how it started? HIV?
Do we know how it started?
That's a good
That's a
question.
good
That's
question.
a very good
That's
question.
a good question. I've heard monkeys. I've heard.
I didn't know about HIV till like the 80s. or
Right.
something, So it must have been going on way before the 80s, but probably nobody like knew about what the disease was. So.
I'm going to be completely honest with you. There have been several stories, research studies, and articles that have been stated as to how it was initiated in Africa, or somebody created the virus and then started infecting it in monkeys, which were starting to be eaten by us humans, and then we got infected by it, or it wasn't. So to be honest with you, I don't know the concrete story as to how it was, because there's several stories out there as to how it has come about. But what I do know is that it exists, and we are trying to eliminate the stigma and definitely get those who are present with the illness to be treated.
Yeah,
You heard that story too?
I'm clueless. I heard the monkey story.
I heard that story too.
So I'm gonna lean towards that a little bit. And I've also heard it originated from here, and the colonizers took it to Africa and started spreading. So it's a lot of stories.
Yeah, wild stories.
All right, the only question I have is, what's the best advice you guys can give us going forward to helping us better ourselves health-wise?
Yeah.
Don't say abstinent because
Go get tested.
Go get tested.
Go get tested.
Go get tested.
Go for your yearly annual physicals.
That's right. Go get a doctor.
Have your partner go get tested.
That's right.
Practice safe
partner.
sex.
Before you meet with a new partner, get tested.
And if you know you're going to engage in any sexual activity with
tested.
anyone at the club, don't drink, because drinking can impair your judgment.
And get tested.
That's a good one. That's a good one. That's a good one. Well, ladies and gentlemen, thank you for watching this great discussion panel put together by iHeart Health Expo.
Absolutely.
Ali Mufa is the
Shout
organizer. Shout out to
Shout
Ali
out to
Mufa.
Ali Boo. Ali Boo Boo.
Yeah.
And by the way, her expo is coming up in February
24th.
and there's going to be
Compton
free
State
HIV
University.
testing, so please come get tested.
Come through.
It's
Come
going to
through.
be in a secluded place, so they don't have to know if you're getting tested or not. So
Oh.
Come through.
don't worry about that.
Okay. I'll be the first. But you won't know if I'm doing it or not. Thank you, Angie. Thank you, Akokan. AK.
AK1.
It's funny. All our names starts with A.
I know,
Interesting.
right? A is a bomb letter.
AAQ. No, triple. Well, ladies and gentlemen, if you're watching HIV and AIDS discussion panel brought to you by iHeart Health Expo in collaboration with Stuck in the Middle Podcast. I'm here, Tabong in the building. AK, Mba in the building. And, your host, AK. Thank you for watching. Till next time.